Morning at NTV. We are live from Kampala Serena Conference Center. Mandru Chamagero Muntwa. Now let's talk banking in the time of COVID-19. And my guest is Mr. Jimmy Onesimus Adiga, the CEO, BRAC Uganda Bank. Welcome to Morning at NTV, Mr. Onesimus.
Thank you, Andrew.
First, I want to commend your bank for two things.
Yeah.
Having the best model that can address the issues of us, Abantu Bawensi, the people, the layman.
Yes.
And I'm wondering if that model can be scaled up on a national level.
Yeah, thanks, Andrew, for appreciating BRAC and first of all for giving us an opportunity to share our success story or the model with the Ugandans. We are pleased that you have recognized through your interaction with the communities the impact of what we are doing in their lives. With respect to replication, I think why we are in this country is to replicate a success story that worked somewhere in the world. BRAC originates from Bangladesh. It was established after an independence liberation war that broke away BRAC from Pakistan in 1971. So BRAC has been in existence since 1972.
Wow.
So the success models of the integrated model of providing both social and financial services to the household, not to fight poverty, but to build their capacities in order to fight their way out of poverty, is what we have replicated in Uganda.
Okay.
Now, our responsibility as Ugandan employees, the leadership of Uganda, BRAC in Uganda, is to replicate that in every part of the country.
Wow.
So the short answer is, yes, it can be replicated, and that is our obligation to replicate it all over Uganda.
Wow. How I wish the government could hear this, because it's a model. I've seen testimonies going around this country, and people have always said that BRAC is the best approach. I don't know why Operation Wealth Creation and all that, they don't buy a leaf from this, but it's something they should engage.
Yeah, they should, and we're already engaging with the government.
Okay.
In all the intervention models that we're implementing in this country, we're working with the respective government ministries. Just at the beginning of August, we visited His Excellency, the President, to tell our story. Say, how are we doing these things? The idea is we have told the technical people, we have told the politicians, we need to tell the head of state what this BRAC model is. What has it achieved? What is it meant to achieve in the future?
Wow.
So that there can be stronger collaboration between the government. Because we study quite a bit of the National Development Plan, the progress being made. We try to align our programming, whether social or financial.
It has to be on the same
It has to be on the same page.
Wow.
Because we are delivering the same service and model for Uganda.
So when COVID-19 came, as a bank that is dealing with people, especially in the rural areas, what did this mean to you? What happened?
Yeah, you know, COVID has... No, at BRAC, we look at building both social and economic resilience of communities so that they can be able to, they can work their way out of poverty. If they are socially resilient, what does that mean? They are food secure. Not only food secure, but nutritiously food secure.
Yes.
Such that they can even fight some of the communicable diseases from food. There's a common saying, you either eat food for medicine or you'll take medicine for food. So we first drive that. That is the social resilience, the first level of social resilience you can build. Thereafter, people need access to health services. Not herbs, not leaves, but modern health services. But also more conveniently. Yes, we appreciate government has invested so much in health infrastructure in this country. But you'll agree with me, health is not about infrastructure. No. It's about the personnel, it's about the supplies, it's about so many other things. So we come in to complement that.
Wow.
Yeah, you know, the government runs the VHT model.
Yes.
Village
you know, my mother is in the VHT of my area. And the other day I went home to visit her and she said, oh, I'm not home. I'm like, where are you? Oh, we're visiting some families. I'm like, okay. And she's, you know, she's so passionate about this.
Yeah. So that is the model we use, and in partnership with the Ministry of Health. Ministry of Health provides training to these community health promoters and VHTs. In BRAC, we call them community health promoters. Government calls them VHTs, but they are doing the same model.
Okay.
So that is the infrastructure we're building to disseminate health services at the doorsteps of the poor communities to build social resilience.
Wow.
But now when people are food secure, they have access to health services, they have access to quality education, and you put money in the hands of these people, you are sure this money will go to productive ventures and it will come back.
Wow.
Because they are spending on medical treatment for children, and the expectant mothers will be less. And they have more money to invest in the business, and they have higher capacity to pay the loans. That's why we provide social services and the financial services come on that. So the bedrock of our intervention is interlinked.
Wow.
The bedrock of our financial service provision is the social services. So the NGO, BRAC NGO, goes providing social services to build the social resilience of communities. The bank comes to provide the financial services to build the financial resilience of communities, and the two put together.
Wow.
3, 4, 5 years, the same household exposed to these services will not be poor.
I understand.
That is our model.
So what are you doing now that we are in the middle of the COVID-19, in the new normal? How have your services, I know it has affected your operations in one or the other, but given that now we're in the new normal, how have you coped up?
Yes, thanks. Of course, the new normal, one thing with the BRAC, back from Bangladesh, Bangladesh is a disaster-prone country. There are cyclones, there are earthquakes, there are floods.
Yes.
Almost is an annual event.
Typhoons are everywhere.
Yes, but BRAC has weathered all this for all these decades, since 1972 to date. And even outside Bangladesh, recently, you remember there was a Ebola crisis in West Africa.
Yes.
BRAC was in West Africa. 8 months shut down, but staff on payroll.
And they kept
moving from financial service provision to purely providing health and safety measures to the community. And I can tell you right now, BRAC in West Africa is back, stronger, growing, and is sustainable. It's profitable, if I can say.
That's the resilience.
That is the resilience that was built. So we are drawing lessons from those success stories of having come out of massive disasters, also to come out of this COVID. What that meant for us is we don't only build safety nets to come out of a disaster, but also build safety nets to come out of future crises that will arise. So even right now, as we are responding to COVID, some of the things we are doing, one is to prevent infection and spread of the pandemic. How are we doing that? Our health program, through the community health promoters, is engaging communities to build the resilience of the communities to cope up with the COVID situation. How do we prevent this? What is it? When you have the symptoms, what do we do? No. And also we are providing the IEC materials, information, education, and communication materials. We are providing the community. We have issued more than 1 million face masks. And I can tell you, in the communities, a mask looks something very simple to me and you. But some people cannot afford it.
That's true. No,
I've been on
the ground.
They're looking forward to someone who can just give one for them.
Oh, yes.
We have gone out to do that.
That's so
in addition to education, we are providing them with those materials. In education, we have built an online learning model in partnership with our funders, our partners, MasterCard for this case. MasterCard has been a very strong supporter of BRAC since its inception in this country. All these years we have worked with them. So they came to our aid with close to $4.7 million grant.
That was a great
to build resilience post-COVID. And that is going to run us for the next 1 year.
Now, when we look at the recovery, how is BRAC positioning itself, or how is BRAC positioning its, should I call them clients? Its clients for recovery in the wake of COVID-19?
Yeah, thank you very much. What we have done during the lockdown, the first way we responded was to provide information to our customers about the COVID. Turning our loan officers into health educators, not loan officers now to disburse loans or to collect. We gave a 4 months loan repayment holiday from April up to end of July. No customer was paying, but we were speaking to them. How is this impacting you? What is changing? When all this stops, what do you want BRAC to do for you? How is the food situation in your house? Who is telling you about COVID prevention within the communities? So
all these are recovery strategies.
Those are all recovery strategies. So through that interaction, we're able to know how to respond to the customers in order to rebuild the lost glories before COVID. So what we're doing is now we're engaging in refinancing because we talked to those who said, while we were under the lockdown in the house, the working capital, we had to feed on that. We used it for consumption, to feed the household. So for me to repay the loan that you gave to me, you have got to give me a new loan. So we're going into refinancing. That is part of, that is why MasterCard gave us money.
That's the model.
To put more money in the hands of those kind of households that have been heavily impacted. Now we are rescheduling their loans. Now we are getting back onto what we were able to do even before COVID.
A Ugandan who has never heard about BRAC Uganda, and these could possibly be the first day to know about BRAC Uganda, how would they get in touch? Are you online, and how far do you cover so that in their districts who are maybe in Iganga or Mbali, wherever, they can possibly just walk into your offices? And what are the prerequisites for them joining your services?
Thanks very much. And we are in 84 districts of this country. We have 163 branches. That is the largest network of service points. And when you get to any of those branches, you get both the financial and the social services. You'll find the health teams there. You'll find the ultra-poor graduation staff there. You'll find the bank staff in those locations. So whichever district you are in, look for BRAC. Actually, many people say we are everywhere. Everywhere you turn, you see a BRAC signpost.
There is a BRAC sign.
Our offices are well identified. Please get in touch with us. We have our website for those who are the youth, who are tech-savvy. Get onto www.brac.net. You'll find all the information about BRAC. Look for us and get in touch with us.
What are the opportunities in BRAC for the youth? You see, me, I'm a youth. Every time I get a CEO of your caliber on this site, I really need to know if the opportunities for my generation with you guys.
Yeah, youth provide a very good opportunity for us to create impact in this country.
Absolutely.
Because the majority, over 70% of our population is under 30. So we have youth-friendly programs. Okay. Right now we are designing a youth strategy, which is to be launched probably next year. To target specifically youth, their aspirations, their ambitions, to get them onto, onto gainful employment, self-employment, because the blue-collar jobs, COVID has done a lot of deal toward that. Also, the direct employment by us. We have so many programs, and we're always going out to employ. We're expanding.
Where you need people.
Where we need people.
Wow.
So once you see that, please apply, join the big family. Let's work together and build the communities.
Well, there you have it. If you're one of those youths who are out there and you're watching Morning at NTV this Saturday morning, well, the CEO of BRAC Uganda, Mr. Onesimus, has made it much more clear that there are opportunities within BRAC Uganda. So if you're one youth who wants to get a job, or you want to be a part of the outreach team, well, log on to www.bracuganda.net, get the information. But if you can't log on to the website, go around your community where you find a BRAC signpost, go to their offices, ask for the information, and not only for jobs, but there are some other programs that could benefit you as a Ugandan, as a lady, and you could change your storyline. Mr. Onesimus, your last word as you're winding up this conversation this morning.
Yeah, thanks so much. We want to encourage actors in education sector. We have developed an online learning solution to facilitate education. This is the new normal. We encourage the schools to partner with the BRAC to drive education learning through those learning models.
Online.
We encourage all the actors in the health program, in the health sector, to join with the BRAC. Let's work together within to root out this COVID situation. Let's change our behavior. Let's drive community behavioral change. Wow. It is only through community behavior change that we can stop the spread of pandemic. We get back to our normal ways of doing things. Finally, join the BRAC Bank.
Join the BRAC.
Join the BRAC Bank. It is the cheapest financial institution in this country. Our charges are very, very low because we are driving development. We are driving empowerment. We are building resilience. We are not there to make money. Yes, we want to do it sustainably, but we also want you as our borrower to be sustainable in whatever you are doing. So we are cautious about that.
I believe that. Well, you've heard, he said that it's one of the cheapest banks. He's lying. It's one of the most affordable banks.
Exactly.
The word is affordable. Mr. Onesimus, Jimmy, thanks for the time. And those who have been a part of this conversation, find time, log on to the website of BRAC, go to their offices, get to know more information, how you can change your sustainable life socially and economically. I'll take a break for now, and now we'll be back.